So cerebral palsy is a permanent, non-progressive condition. It's also a developmental disability, meaning that it happens in childhood, and most commonly cerebral palsy is going to happen before, during, or immediately after birth. It's fairly common for it to be related to loss of oxygen during labor. It could also be a lack of development. So part of the brain didn't develop correctly, something like that. The main impairment is in motor coordination. So they may have difficulty using with fine motor control. For example, my niece had a lazy eye, so she had difficulty in her eye muscles. She held her right arm up. She had difficulty controlling it. There was lack of flexibility there. And also still limps with her right leg, although she's come a long way, and she had a mild impairment to begin with. So the main thing is motor coordination, but it can also affect, because it depends on how and where and to what extent the brain is affected during this injury. It can affect speech. It could affect vision, hearing, touch. It can affect intellect, so it could be cerebral palsy and an intellectual disability. But most of the time, people with cerebral palsy don't also have an intellectual disability. So don't just make that assumption. Cerebral palsy, also fairly common, but still less than 1% of the U.S. Children are diagnosed with cerebral palsy. It can be classified several different ways. These are the most common. So monoplegia means that just one limb, and it doesn't have to be the arm, that just was the example that I chose, but just one limb is affected. So it could be just the hand, just the foot. And so monoplegia means one, mono, one. Hemiplegia, on the other hand, means that it's just one side. So you think of hemisphere, just one side. So all the right side is affected. So like my niece, I give you that example. Her lazy eye was on her right side. The arm that she had difficulty with was the right side, and the leg was the right side. Left side, completely fine. And so that means that there was damage to only one side of the brain, essentially. Paraplegia means that only the lower limbs are affected, and depending on the degree of injury, that could be from the hips down, it could be just at the feet. It really just depends. But it does mean that the hands and arms are not affected. Whereas quadriplegia is all four hands, all four limbs. So hands, arms, and legs, all affected. It can also affect head and trunk in some cases. Spinal cord injury is classified very similarly, but it's a different injury. So cerebral palsy occurs in the brain. Spinal cord injury, of course, happens in the spinal cord. It means that there was some kind of injury that severed the spinal cord, which prevents communication between the brain and the rest of the body. So if the brain can't send commands to the muscles don't work. And if the sensory system can't send information back up, that also affects motor behavior, but it also affects the autonomic system, heart rate, blood pressure, all of those things. So if you're working with somebody with spinal cord injury, you're going to be aware that they're going to have difficulty with adjusting to heat. They're going to have difficulty adjusting to their heart rate during exercise. Any kind of painful stimulus is going to significantly jack up their heart rate and blood pressure, may even cause sweats or seizures. So you'll need to be aware of that. And just depending on whether it's a complete or incomplete injury, it probably affects both motor and sensory, but there are cases where only one or the other is affected. Usually it's a mix of the two. And so the cervical, a little bit of anatomy for you. The cervical nerves start at the top of the spinal cord and go into the arms. So at this level, you're definitely going to see impairment in both the arms and the legs. So if it's below the lumbar level, then you're probably only going to see impairment in the legs. Thoracic nerves mostly are related to your internal organs, but it might also reflect problems with posture or abdominal control. Autism is one that's generally confused with intellectual disability. It's not the same thing, and it shouldn't be grouped in. Occasionally, people with autism also have an intellectual disability, but a lot of times, more commonly, a person with autism is actually usually highly intelligent. They just have really hard time expressing themselves. So to be diagnosed with autism, you have to have symptoms before age 3, but doesn't necessarily mean you have to be diagnosed before age 3. So you might have noticed these symptoms the whole time, but didn't realize it was an actual diagnosis. You just thought it was weird. You thought it was hard to deal with, but you just kept dealing. But you saw the symptoms earlier. So it's still possible for a child to be diagnosed with autism later on in life. So it affects verbal and nonverbal communication, which means they may have problems knowing what to say. They don't usually do well understanding, if they're going on and on and on about a topic and you're averting your eyes, checking your watch, we know that means that you're annoyed, you're ready to go, you don't want to talk about this anymore. They're not going to catch on to that. Okay, so those kinds of things. They're not going to necessarily understand sarcasm. That's a big thing. If you ever watched Big Bang Theory, not everything is portrayed correctly, but that's one of the things that's fairly funny on that show. They're constantly talking about Sheldon doesn't understand sarcasm. And then general social skills, making eye contact, knowing when to stop talking, to take turns, those kinds of things are going to be challenging. They also usually portray some kind of repetitive activity or stereotype motion. So they may flail their arms and hands, rock back and forth, continuous clapping for no reason. And some of those are response to a stimulus of some sort. Some of it's just spontaneous, and some of it's a comfort thing. It really just depends on the individual. So it's getting to know that person, what causes those movements, those interruptions, and then figuring out how to avoid those situations if possible, or help teach them alternatives that are less distracting or disruptive. As far as autism goes, we're still really, for the most part, trying to figure out what causes it. We do know that many cases of autism are related to Fragile X syndrome, which is a genetic disorder. They've also done a lot of work with twin studies that suggests that there's a genetic basis to autism, but we haven't found a cause that fits all diagnoses of autism, and that might be a diagnosis problem rather than finding a cause and effect problem. But anyway, still in research. Another fairly common one is amputation. If you go on the field trip to the Adaptive Training Foundation, this is one of the more common injuries that's seen in that gym. So an amputation is just a loss of limb. Could be for any reason. Diseases such as cancer. So if there was a unchecked growth in a limb, they may just remove the limb entirely to try to get rid of the cancer. If it's with diabetes, sensory loss is fairly common, which means that, and it usually starts in the feet, so they may not notice that they had a cut which got infected. and the infection spread. And so amputation is fairly common with diabetes when they're not taking care of themselves and it gets to that extreme point. A lot of times it's trauma. That's what we see with our veterans returning from war. So there was something, they ran over a IUD or something. Occasionally, it's not occasionally, but it can be also congenital, which means that the limb just never formed correctly. And so that's where you'll see people that have just little stubs for fingers or toes. That's probably a congenital disease. Usually amputation is classified as either above or below the elbow or above or below the knee, depending on, so if it was the foot was removed, that's a below knee amputation, and you kind of get the idea. Most will use a prosthetic. Some will not. Some will just learn how to use whatever's left of their limb to continue to do those same tasks. Probably depends on the person and what they're the most comfortable with. Prosthetics come in all shapes and sizes. They even have some that you can, especially for the arm, they have like tools basically at the end of them, instead of like not necessarily always a hand looking end, but maybe a hook and maybe a claw or something to help them with specific tasks.